I took over $100,000 worth of stem cells to save my career after a devastating injury.
A bicep tear is a terrible injury, regardless of who you are. But when you're a pro athlete, it can be life-changing, especially if you are a pro arm wrestler like me.
This is the next phase of your life. The time waits for no one. Even the greatest of the greatest all have a day when they have to come back and say, you know what, I have to transition to something else.
My bicep reattachment went well.
That's the button holding the tendon down, so we know it's up against the bone, so we know that's where it needs to be.
However, the bicep tear was not the only thing standing between me and my next attempt at a world title.
I do realize that you do have really, really, really bad arthritis. And I'm gonna be honest with you, I know you don't want to hear this, but you are gonna have a total joint replacement someday.
That was the first thing my surgeon told me when we were looking at my x-rays, and it's been on my mind ever since.
With the help of QC Kinetics and VitaCell Biologics, I've been fortunate enough to receive well over 6 figures worth of treatments that used to be only available to the highest level of athletes. And I'm excited to share my experience. Meet Amber.
Hey everybody.
She's my nurse practitioner. For the last year and a half, she's been administering all my treatments.
I was anxious but excited because this isn't something that I've got to do with anyone else.
So is it excessive the amount of treatments I've had? Because I've done 5 rounds of stem cells, A2M, and PRP all in like 4.5 months.
Yeah, that's excessive.
One day I was here and I did 23 shots. 12 here and 11 on my back.
Yeah, so as many shots that I give people, you have done very great.
Listen, I've seen men scream for these elbows.
All I keep thinking is, okay, that hurts, but I'm going to be Superman when this thing's done. Actually, not Superman, Hulk. Be the Incredible Hulk, right?
So the injections themselves were not painful. It's just the pressure once you inject the stem cells. Because some of the times we're injecting it into like some small spots. Like, remember the wrist one?
Yeah.
Oh my goodness.
I got to pop my thumb.
I went and popped my thumb. It is right after you gave it the thumb shot.
That's tender wherever you're poking it. Yeah, hang on a second.
Oh my God.
Yeah, and I was just like, don't do that again. And it wasn't
I think
as
it was like the
bad.
second stem cell. So we've done like 5 more treatments.
Right,
So
and it wasn't as bad.
Yeah, I haven't popped the thumb since.
Right.
What's crazy was that inner elbow almost never hurt me. And I was always in that weird position doing it.
Yeah.
Some of them though, you could definitely feel. That's when you're that.
Yeah, the breathe, which you did great at.
That kind of helps.
And that's all common. I mean, really, how you experienced it is what most people experience. Each person, we obviously have you come in, we evaluate you, we assess you, and we see what's going on. And then based off that, we make up a protocol that we think's best for you. I think it was just so important that we treated, not just the injury to the tendon, but the arthritis as well. And so that's why it was so important for us to treat you with A2M, because that's a specific treatment that's going to get all that arthritis out and for you to be healed.
That's alpha-2 macroglobulin. This is a protease inhibitor.
So one, we take it from your blood. We spin it, filter out that A2M molecule.
Once that A2M gets in there, that molecule sits on that receptor site, and it actually prevents the degeneration of the cartilage.
When they sit in there and slowly deteriorate a joint over time, that's when you have issues later on.
We're preventing that future-wise for you today, but then we're also, any of those joints that have those enzymes in there that are breaking it down right now, we're gonna prevent that.
A2M sits in those receptor sites long term, like we're even seeing in research 10 years.
Oh my goodness.
Yeah.
You said like 8 to 10 years.
Yes, yes, 8 to 10 years. We go a whole month from that time to let it get out and heal itself, okay? Then when we put stem cells in there, they're literally starting like in a brand new environment. Yeah, they're not having to compete anymore. And then 2 weeks usually after that, we do a PRP. So PRP is platelet-rich plasma. This once again comes from your own blood. So we take some blood from you, spin it down, get the platelets out. Platelets are very important for healing because they stimulate growth factors to come to the area. Anyone who gets an injury, a cut on their leg, breaks their ankle, whatever, you have swelling, right? Okay, that swelling is actually, plasma bringing platelets to that area too, which bring growth factors. What do we need to fix? That's your body's natural stages of healing. We put those in on top of stem cells, and we have found in research, once again, that PRP with growth factors almost like stimulates stem cells to work even better. It's kind of like, I say, putting gasoline on the fire. Some people are like, well, do I really need PRP if I had stem cells? Because they're like, stem cells are better, right?
That's how most people think.
And absolutely, I mean, if you think, if we're looking just at stem cells and just at PRP, yes, stem cells can do so much more. But PRP does not need to be overlooked.
Right.
Especially when you're using it conjunctively with stem cells. Yeah.
We have platelet-rich plasma, PRP. We just have the plasma. What separates those two? Why are they different?
Plasma has anti-inflammatory markers. So like an ibuprofen that you would take, I'm just going to put it directly into the joint. Anytime there's inflammation in a joint, it's competing with healing. If we try to keep the inflammation down, it goes into that healing cycle of trying to actually maturate and proliferate anything to the end point. We start off with plasma with most everybody just to get inflammation down, so that's one treatment. The A2M, stem cell, PRP, and then we usually end with a plasma as people are just still continuing to slowly heal. Each treatment is really important in that process of healing.
And what type of results do you see with that normally?
We have a 92% success rate.
Holy.
Yeah. Yeah, with that protocol. It's just
Of all ages or?
yeah,
It doesn't
absolutely. Yeah, and I treat bone on bone, knees, hips, shoulders, spinal stenosis, degenerative disc disease, bulging of disc, herniated disc.
To a lot of people, stem cells have been only used recently, but that's really just not the case. Wound care has been using stem cells for like over 20 years to heal wounds, to heal cartilage, to heal, so it's just really amazing when you go through learning there and you're like, well, it makes absolute sense why it helps with joint repair. With that, there's more clinics opening up using these modalities for QC Kinetics. We have 205 locations in the United States. So there's almost one in every state. And so you can literally just like look up QC Kinetics wherever you're from. It's going to find the closest one.
What is the difference between getting the bone marrow stem cells or the umbilical cords from healthy delivery stem cells? What's the difference?
You can get stem cells from different places. You can get them from fat cells. You can get them from bone marrow. You can get them from umbilical cords from babies who are born. Just to kind of clarify here, umbilical stem cells, they are once again monitored, and they're not from babies who unfortunately maybe pass away. It's from moms who are having to have repeated C-sections. They're vetted before that, like they know, and they're asked, hey, would you want to give your umbilical cord for stem cell technology after your baby is born and the umbilical cord is cut away from the baby? If they say yes, they're vetted, lab work, extensive history. There's a lot of work being done. When it comes from your own body, it's your own stem cells. We extract them from the PSIS, the posterior sacral iliac spine. That's kind of like the butterfly bone of the pelvis, and it's flat. And research has shown that when we take bone marrow from that specific area, that it's actually got the highest quality stem cells. The only place that I kind of say that one might be better is in someone who's very advanced in age. Right. Okay. I have a handful of patients who are in their 90s, and treating them. And so obviously their stem cells are 90 years old too. Now I've still gotten good results from them, but it's taken longer. Just, as working in this for 3 years, right. I can tell that those patients take a little longer to heal. But at the same time, it's like, well, are they taking longer because their stem cells are older or because they're older? When you're 90, you don't heal as well. You heal slower. So it's kind of, but they still get better. And so that's where, you almost had to get people off that scare, right. Get them educated, get them more educated for them to believe in, okay, this is something that actually a lot of good comes out of. Preventing surgery, preventing pain pill addiction, preventing loss of jobs because of recovery. It's non-invasive. There's no downtime for anybody. They can come in, get treatment, go back to work.
Perception was that stem cells 10 years ago were only for the extremely wealthy, right?
Right.
It's impossible to get stem cells unless you're super rich or celebrity or something like that. Is it becoming more available to the normal consumer, like the average consumer?
Absolutely. I have patients that obviously maybe they don't have, the money to pay for it right out. But even at QC Kinetics, we do financing. And so we can get people as low as almost $90 a month.
Oh my God, really?
Yes. Now, average is about $150 a month.
Let's say you got down to $150 a month for the full gambit, the whole treatment.
Yeah.
And it does change your life. What if it gave you 5 more years of your life? $150 a month doesn't even make a dent in your grocery bill.
I have people that just say, this affects my daily life in so many negative ways. And it's like, okay, what if in 6 months I got you completely pain-free? 92% of my patients get 100%. That's a high percentage.
I'm so happy. And this is one thing I want to share with you. This is what's exciting to me. Everything I've been doing, because we keep getting treatments, is I've been doing maintenance workouts. So essentially, I've been doing workouts that I should not be getting stronger from, because I have not pushed myself in my workouts to make myself get stronger. But yet, 8 weeks ago, on a new lift I started, I could only do 85 pounds for 10 reps. And just yesterday, I did that same lift for 110 pounds for 10 reps. But I've done nothing in my training to make me get stronger.
Yeah.
So I think the stem cells and A2M and everything has just healed me up to a point because now I get to start pushing myself in my workouts to actually see what I'm capable of.
Right.
Because we haven't been able to do that because you have to keep the weights light.
Even light for you, it's not light, but
Exactly.
But yeah, I mean, I haven't really wanted you to push because I'm causing a trauma response.
Right.
Anytime I break the skin, go into a tissue, cartilage, or joint, people think, oh, you're going to fix it. But it's like stem cell technology does so much more than that. It actually strengthens everything. Like it strengthens the tendon, it strengthens, the bone, how the bone articulates. It increases cartilage, your cushion inside the joints. It can even almost increase like synovial fluid that sits in the joint to allow it to kind of like rotate the way it needs to. It's not just going to fix one thing. Stem cells fix everything wherever they're at. And so that's where I think why you've had such success with feeling strong and just being able to do all these things that you haven't even tried to really increase on, but they're just naturally increasing.
What is available now through regenerative medicine is life-changing.
Yeah,
it truly
absolutely.
is.
Once again, without the support of VitaCell Biologics and QC Kinetics, I wouldn't be able to have all these amazing regenerative medicine treatments. Be sure to check those guys out and stay tuned as I go back to world number 1.